Hello everyone. So today we are going to discuss about chapter number 6, adverse drug effects in KD3 party medical pharmacology. So let's straight dive into the subject. Adverse effect is any undesirable or unintended consequence of drug administration. It is a broad term, includes all kinds of noxious effect, trivial, serious, or even fatal. So basically, adverse effect mean it is a broad term which includes like all kinds of side effects, uh, serious effects, or even fatal consequences after the drug administration. For the purpose of detecting and quantifying uh, only those adverse effects of a drug vehicle which are of some import and occur in ordinary therapeutic setting, the term adverse drug reaction has been defined as any noxious change which is suspected to be due to a drug occurs at doses normally used in man, requires treatment, or decrease in dose indicates caution in the future use of the same drug. So to differentiate between adverse drugs caused by drug, like adverse effect caused by drug, and adverse reactions caused due to some other reason, there is term called adverse drug reaction. So adverse drug reaction means any noxious change which is suspected to be due to a drug occurs at doses normally used in man, requires treatment, or decrease in dose indicates a caution in the future use of the same drug. So like I said, this definition excludes trivial or expected side effects and poisonings or overdose. Then another term is like adverse drug event. So what does this mean, adverse drug event? So it means any untoward medical occurrence that may present during treatment with the medicine, but which does not necessarily have a causal relationship with the treatment. So adverse drug reaction means like any adverse effect which is due to, or which which is suspected due to a drug is called as adverse reaction. But in adverse drug event means any adverse reaction or adverse effect which is not due to, which is not suspected to be due to a drug. Okay, so that is adverse drug event. So basically it is the event like untoward medical occurrence that may present during treatment with medicine, but which does not necessarily have a causal relationship with the treatment. Means whatever drug we are giving, it does not, if it does not have direct relationship with the treatment or drug that is given, is then the reaction is called adverse drug event. All drugs are capable of producing adverse effects, and whenever a drug is given, a risk is taken. So this is very important. Like all drugs, like from paracetamol to anti-cancer drugs, they have risk. Okay, so like they produce adverse effects from like for paracetamol also adverse effect there, and anti-cancer also. So whenever we take a drug, we have taken a risk. But why we take the drug? To get the benefit, right? The magnitude of risk has to be considered along with the magnitude of expected therapeutic benefit in deciding whether to use or not to use a particular drug in a given patient. So we have to balance, means we have to check uh, is are the risk more or benefit is more. Okay, so we have to check the balance, like risk benefit ratio. Okay, we have to see the risk benefit ratio. Are the benefits are more than the risk, then only we will use the drug. So for example, even risk of bone marrow depression may be justified in treating cancer. So like anti-cancer drugs have this, like but uh, I'm forgetting the drug, but a lot of anti-cancer drugs have adverse effect of bone marrow depression, because anti-cancer drugs uh, prevent the mitosis. Okay, prevent the mitosis of or cell division. And but in bone marrow, like the rapidly dividing cells are there, so it also prevents mitosis in the bone marrow. So a lot of anti-cancer drugs have this side effect, bone marrow depression, but it is justified because we don't have safer drugs. Okay, so we like anyway, patient is dying from the means having problem with cancer, is so much in pain. So we give the anti-cancer drugs even if it has bone marrow depression as adverse effect. But while mild drowsiness caused by an antihistaminic in treating common cold may be unacceptable. So antihistamines we use in treatment of common cold, and some antihistamines like older generation antihistamines, they cross blood-brain barrier, and they induce sleep, drowsiness you can say, and that is also unacceptable because just we are taking common cold. Okay, so that is like in newer generation we developed the drugs that means very less they cross the brain barrier, blood brain barrier, and which has very less they are very less susceptible to cause drowsiness. So we have to see risk benefit ratio. Then adverse effect may develop promptly or only after prolonged medication, or even after stoppage of the drug. So some adverse effects we see after immediately, like after taking the drug in a few hours or few days, but some take prolonged time to show the effects, and some also show the effect when we stop taking the drug. That is called withdrawal symptoms. Okay, drug withdrawal symptoms. Adverse effects are not rare. An incidence of 10 to 25% has been documented in different clinical settings. So adverse effects are not rare, like 10 to 25% adverse effects has been documented in different clinical settings. So each drug causes adverse effects. Only the magnitude of adverse effect we have to take in consideration while administering the drug to treat a given condition. They are more common with multiple drug therapy and in the elderly, because when we take multiple drugs, they they may have synergistic effect. They may cancel the effect of each other. So when we take multiple drugs, it is the possibility of adverse drug reaction becomes higher, and in the elderly patient also. So in the elderly patient, their metabolism is not that strong as in comparison to the young patients. So they are also more susceptible to the adverse drug reactions. Adverse effects have been classified in many ways. One may divide them into. So now we will see what are the classification of adverse effects, like how uh, the experts or the literature has classified them into different categories. So first classification is upon predictability of adverse reactions. Okay. So first type is predictable reactions also called as type A or augmented reactions. So these are mechanism based adverse reactions, means uh, we know it will occur. We know these reactions will occur if we take the given drug at a given dose in a given medical condition. Okay, so these are based on the pharmacological properties of the drug, which means that they are augmented but qualitatively normal response to the drug. Let me highlight this. Okay, so these are based on pharmacological properties of the drug, which means that they are augmented but qualitatively normal response to the drug. So this is normal response to the drug, and which is due to pharmacological properties or the site at which it targets. So that it includes side effects, toxic effects, and consequences of drug withdrawal. They are more common, dose related, and mostly preventable and reversible. So these type A predictable augmented reactions are more common, dose related, means as we increase the dose, the intensity of adverse reactions will increase, and they are preventable by decreasing the dose, uh, and the adverse reactions are reversible, means once we stop the drug, they will disappear, like we will get the relief from adverse reactions. But the let me second type is unpredictable, type B or bizarre reactions. Okay, so what this is, let me highlight. So these are based on peculiarities of the patient and not on drugs known actions. So unpredictable reactions are based, uh, they are, we can't predict this will they will occur, because only in some percentage of patients, only in few population categories they will show their effect, which includes allergy and idiosyncrasy. So idiosyncrasy means adverse reactions not means that are not predictable. Okay, they are less common, often non-dose related. So they are not they are not common. As I said, they occur in only few patients, like only few percentage of patients. And non-dose related means it is not related to the dose of the drug, generally more serious and require withdrawal of the drug, and they are generally more serious than the predictable reactions, and it requires withdrawal of the drug. Means if we can't continue giving the drug if unpredictable reactions occur in the patient, because they are serious, and it can be fatal if you continue the dosing. Some of these reactions can be predicted and prevented if their genetic basis is known and suitable test to characterize the individual's phenotype is performed. So as I said, like it is in only few patients. So why only in few patients? Because they have, because of their genetic uh, makeup. So because of the, like, some enzymes are less in their body. Okay, so because of the genetic characterization. So if we characterize the all the genome, okay, so then we can prevent this type of reactions by knowing the which type of drug can cause the adverse reactions. Thank you. We will see next in next video.